morning. This is Alejandra, your oncology and hematology nurse practitioner. Happy Thursday. I have today and tomorrow for hospital rounding. And after that, I have a weekend off, which I'm very excited because today is my 11th day, consecutive day of work, and I'm kind of tired. I'm heading over to the hospital, so I'll finish this video later. But I want to talk about death a little bit as an oncology nurse practitioner, and really as a nurse in general, any RN. There is always a time where we experience our first death. And someone asked me about this recently, so I want to share my story of this patient that is still in my heart, still in my mind, from about 10 years ago. And that was my first patient that died. Okay, so that was a good day of rounding. Now, let me share the story of the first patient that I saw dying. So this was when I was a brand new registered nurse. I had finished my training, and it's my first week by myself with my own patient load. I had about 4 patients, which it was normal in my oncology floor. Most of them were normal acuity, so it was pretty manageable. But there was one patient that I was managing for GI bleed, so he was having rectal bleeding, a lot of it. Unfortunately, he had a colon cancer, and there was a mass that was bleeding. So literally, I had to transfuse blood back to back to back, lots of blood transfusions during my shifts because he just continued bleeding. He had had chemotherapy, he had had radiation therapy, but unfortunately, there was nothing else we could do for him. And he was not ready to do hospice care. He wanted to continue fighting, but he was losing a lot of blood. So I had to continue giving him transfusions. I remember him so clearly because if you're a nurse, you know that GI bleed has a specific smell. So his whole room always smelled like with this really strong odor that I knew he was still bleeding, and I knew that I still had to continue giving him the transfusion. Taking care for 3 days, we got very close, and I remember he was from West Virginia, and one day we were talking about it, and we started singing Country Roads, the song, and we held hands. I was holding his hand, and we were singing the song. He was smiling so much, and it was a super sweet moment. By the third day that I was taking care of him, it was not amount of blood that we can transfuse for the amount of blood that he was losing, and he ended up passing on my shift. He was my first patient. I had to prepare his body, clean him, and get him ready to get moved to the morgue. And I still remember him, and I'm honored that I was able to be with him on his last moment.